Dr. Co back from simplemedschool.com. We're going to get on to the next topic, subdural hematomas. So, a little different with subdural hematomas. It's going to be a slower bleeding versus the epidural, where it was a rapid gush of blood from the middle meningeal artery. So, let's review the anatomy briefly. You have the skull, the bone layer, you have your dura, arachnoid, and pia mater. So sub refers to below the dura, below the dura. So here is your collection of blood. It's below the dura layer. And imagine if you're taking it from an axial view, a view from the top, you're going to see the skull here, and you're going to see the blood collecting below the dura. Actually, you're not even going to see the dura on CT scan. The biggest thing you're going to see is this crescent-shaped appearance of blood. And that's different from the epidural, because with the epidural, it was coming outward like this because of that high pressure. Whereas with the subdural, it's a slower one. It's crescent-shaped. So crescent, croissant, boom. It's going to look like a croissant, crescent-shaped, subdural hematoma. So why does it look like a croissant? Why? And the biggest reason is these are bridging veins. And with veins, they're a slower type of bleeding. So you're going to get slow venous bleeding. Remember, that was different from the epidural, where it was the artery that was gushing out blood. Now, who are the patients who are at risk? So there's a few that I want to highlight. We have the elderly. We have alcoholics. We have those with blunt trauma. We have those with shaken baby syndrome. So if you remember, as we age, things kind of shrink, wrinkle, and that's one of the things that happens with elderly patients as well as alcoholics. There's more space in the brain. There's more space underneath the skull. And as a result, when they get trauma, they're going to have this slow venous bleeding. One last thing to mention, guys. Because the hemorrhage is underneath the dura, subdural, what's going to happen? There's no dural attachments here, here, here along the suture lines, meaning that the blood can cross suture lines and spread all along the inside layer underneath of the skull. So before we go, one thing to remember is that the rupture of the bridging veins is caused by sudden acceleration, deceleration forces. So for example, if you're in the car and all of a sudden someone pushes the brakes, boom, that can rupture bridging veins, especially for those at risk, elderly, alcoholics. And it's going to present in a couple of different ways, whether it's acute or chronic. And with the acute, you're going to see them, it's going to be after a car accident, it's going to be after trauma. They're going to present generally unconscious. The more chronic nature, it might be someone who's elderly, it might be someone who's alcoholic. They're going to present with altered mental status, confusion, or maybe just simple vague neurological symptoms that have no explanation until we get a CT scan. One of the things I want to mention is about CT scans. So when we order a CT scan, new fresh blood is going to show up white, whereas older clotted blood is going to show up as a gray-black material. So one of the things that you're going to see on CT, if it's an acute bleed, is going to be a white layer. And whereas with the chronic, it's going to be more gray layer of blood. And as far as the treatment for it, of course, we're going to want to get a neurosurgeon involved. And if they're going to make an ultimate decision. Sometimes they'll go in and do a treatment like a burr hole. Other times they'll monitor it, especially if it's more chronic in nature or not causing that many symptoms. There's also medications that we can use, similar to the ones that we use for the epidural. There's mannitol, hypertonic saline, just elevating the bed 30 degrees to decrease the ICP within the brain. And one of the other biggest risk factors is patients on anticoagulation. So there's a lot of people who are on medicines like warfarin, Pradaxa, apixaban, Eliquis, Coumadin. All of these things are blood thinners. So with that, we want to reverse these agents. We know some of the agents have reversals and some of the others don't. So it's very important to take a clear medication history to know exactly what they're on. Hey guys, thanks again for joining me. If you want more wisdom, more knowledge, more benefit for your patients, come join me. SimpleMedSchool.com. I'll meet you there.